Hello, everybody. My name is Philipp Zimmer. I'm a researcher, professor for performance and health at the Technical University at Dortmund in Germany. And my research for many years is focused on the impact of exercise, on the impact on the immune system of patients with cancer. And of course, especially during these complicated days with Corona crisis, isolation, quarantine, and so on, physical exercise plays a pretty important role. And I just want to give you a short overview about the evidence of how exercise impacts cancer itself, but also the side effects of its treatment. And this is what we're going to do right now during the next couple of minutes. So when we talk about evidence, it's all about studies. And as you can see here, the number of publications strongly increase, a little bit like the corona disease. And what we see here is not only that we have an increase in the number of publications, but we have also an increase in quality. And I want to share some of these high quality studies with you in the following minutes. The point is, when we talk about physical exercise or physical activity in general, that we know right now, independently of cancer, that if we are physically inactive or do not exercise, we have a strong adaptation of our body. And you can see how the body adapts to physical inactivity. And we start with 20 to 30% loss of strength. So we have a really strong reduction of muscle mass. And as you can see here, that happens pretty fast. So during 7 days, you already have a massive decrease of strength. And you can imagine that you need, independently of how much you exercise in the follow-up, you will need around 2 to 3 months to recover from this loss. We also have a reduction of oxygen uptake, which is the main indicator of our endurance capacity. So what you usually understand as fitness in general. We have some other parameters which are also associated with endurance capacity. For example, here the reduction of blood volume. And in this context, of course, because blood is also related to immune function, we can see that we have a decrease in immune function as well. So these are all consequences also for healthy subjects of physical inactivity. And we have some decreases which are much more related to persons with cancer. And because these persons usually have side effects of the treatment. And you can see here that inactivity in general decreases bone density. And you can imagine what happens if you have bone metastasis or osteoporosis, then this might increase the risk for fractures. So this is pretty important as well. And last but not least, we have a decrease in motor sense and coordination, which is also an adaptation of the central nervous system to physical inactivity. And of course, if you stay active, you can counteract this. And it's not only the motor function or the coordination, it's also the IQ or the cognitive function, which decreases with physical inactivity. So as you can see here from this slide, there are many implications for staying active, not only for cancer patients, also for healthy subjects. But especially for cancer patients. So here I want to show you right now what we know currently from observational studies, so where we look at people over several years or months, and what we know about primary prevention. That means how physical activity impacts the development of a cancer disease. And these are pretty new data, and it's an overview. So there are many studies which are summarized in this overview. It's what we call meta-analysis. And what you can see here is that we have a really strong risk reduction with an increase of physical activity of the most common types of cancer. So you can see colon, breast, kidney, endometrial, bladder, and so forth. So all these diseases can be prevented if you are more physical active. There's only one exception, and that is what you can see down on the right side. So for the melanoma, we have an increase of risk with physical activity, but that's pretty logical because people who exercise a lot stay more outside, so they have more exposure to the sun, and this increases the risk for this type of cancer. There are pretty much data right now from the past few years which are really clearly indicating that an increase in physical activity can definitely decrease the risk of cancer mortality. So the more active you are, the less probably is that you die from your cancer disease. And what is pretty interesting in this context is that it's not only true for your physical activity level or exercise level before diagnosis, it's still true for your activity level after diagnosis. So this is something you should keep in mind, and what is pretty important, even if you are diagnosed with cancer, you can still do something against it. And of course, these data are usually assessed by questionnaires and surveys. So you could say, okay, this is not that objective, and maybe people tell that they are more active than they really are. But in fact, we have some studies which have investigated the same association between physical activity and cancer mortality for more objective physical activity or endurance capacity data, which is shown here. So what we have here is the cardiorespiratory fitness, which you are usually assessing in a laboratory. And what we found here is that an increase in physical activity and an increase thereby in the cardiorespiratory fitness is also associated with a decrease in cancer mortality. And the good news is that this is not only true if you compare really high cardiorespiratory fitness versus low cardiorespiratory fitness. It is still true if you compare intermediate cardiorespiratory fitness with low cardiorespiratory fitness. That is what you can see down there. And that's really good news, because this does not mean that you got to be a professional athlete or something like that. It's still important to exercise a little bit and to work out a little bit and to increase your fitness, and thereby reducing your risk for cancer mortality. So during the last slides, I've talked a lot about physical activity in general, and the last slide was more focused on endurance capacity. And here's a nice observational study with a total of more than 80,000 adults, which have been included in this study and observed over a period of time. And what we found here is that strength training itself is also important. So usually it's always endurance exercise, which is associated with benefits for health in general, but also in cancer. But this study clearly shows that strength training itself has also a strong impact, and we have pretty similar associations between strength training and a benefit for survival in cancer patients. So what you should keep in mind is that it's not always endurance exercise, but it's also strength exercise, and especially the combination of strength exercise and endurance exercise, which brings benefits. On the last slide, I was talking about endurance capacity and endurance exercise, cardiorespiratory fitness. And of course, this is pretty important. And easy examples for endurance exercise could be walking, could be running, could be swimming, and so forth. So these are classical endurance exercises, just to give you an idea. And on the other hand, we know that strength training or resistance training is also pretty important. And just to give you some examples for strength training, this could be something like a squat or a push-up or a pull-up. These are the most common ways of strength training or strength workouts. But of course, something like yoga might also be some kind of strength training. And so what you can see is that we have a wide spectrum of these kind of exercises, and you do not have to fear that you have to be a marathon runner or something like that in the end. It's more important that you are related to your physical condition, do what you can do, and stay active. So this is the main message. So far, I've talked about epidemiological data or observational data, and what I show you right here, apart from survival, which is definitely maybe the most important thing, that physical exercise and maybe targeted exercise interventions can definitely also improve side effects from cancer or from cancer therapy. And this is just a summary of what we are currently knowing and where we have good evidence for. So all results from meta-analysis or randomized controlled trials. I've already talked a little bit about aerobic capacity and strength training. So this is nothing really new, but we have really strong evidence that not only after diagnosis or after treatment, but also during treatment, physical exercise can still improve your aerobic or endurance capacity and your strength capacity. But we also have some really good evidence right now for a reduction of some side effects, and I've just listed them here, in this table. The most important might be the fatigue syndrome, which is pretty common in cancer patients. And to date, there is no medical treatment or other kind of supportive therapy which is that effective in reducing fatigue than physical activity or exercise. So we have really strong evidence for that. We have some really high quality studies indicating that physical exercise or physical activity can reduce fatigue syndrome. And we have some other side effects, and we know that we can reduce all these side effects by targeted physical exercise interventions. We have really strong evidence from randomized control, high quality studies that exercise is beneficial for quality of life in cancer patients. And again, this is true for the phase after treatment, but also for the phase during treatment. And therefore, there should be no reason not to exercise or to stay physically active immediately after diagnosis. Besides all these side effects, we also, which we can tackle with exercise, we also have some evidence that we can reduce the days you have to stay in hospital during treatment. So this is something what you should also take into account, and what is might be of special interest during this corona crisis, where a lot of people fear to go to the hospital. Of course, if you have side effects, you should definitely go there, and if you have severe problems. But as you can see here, exercise might reduce these side effects. If we sum that up a little bit, we can say that it is pretty important for your general health to stay physically active and to avoid physical activity, what might be challenging during this corona crisis. The next thing is that we know that we can reduce the most common types of cancer through physical activity, or the risk for these types of cancer. And we know that we also have an impact on survival if you are diagnosed with cancer, and that's maybe the most important news for you. The other thing is that and this is something you should really take into account, that it's not always endurance exercise what is beneficial. It might also be strength training, or if I would recommend something, I would say it's the combination. And besides reducing cancer risk or mortality, we also know that we can tackle a lot of side effects from cancer itself and its treatment, and thereby we can increase the quality of life. And this is something you should feel and where you should be part of. And last but not least, and these were the last slides I was talking about, is that we have a reduction in hospital admissions and length of hospital stay. And especially during these days here, this should be taken into account. So thank you very much for watching, and let's get it on. Stay physically active. Thank you.